Welcome to Voices of Care, the podcast series from Newcross Healthcare that seeks to get to the very heart of the issues facing the health and social care sector by speaking to leaders that are truly enabling the healthcare workforce of the future. I'm Suhail Mirza. The NHS is rarely out of the news. Waiting lists, growing demand, cost of living crisis, and of course, strike action. It's therefore vital to understand and hear from leaders who've been at the heart of transforming the experience and engagement of the workforce. I'm therefore delighted to welcome Laura Skaife-Knight, the Deputy Chief Executive Officer of Queen Elizabeth Hospital, Kings Lynn NHS Foundation Trust. Laura, I'm delighted to welcome you and thank you for giving us your time and welcome to the series.
Thank you so much. Thank you for the invite.
It's always a pleasure. I want to start off by attacking the headlines. The commentators are calling this period the most challenging crisis that the workforce in the NHS has ever faced. We've got vacancy levels running at 133,000. The recent NHS data showing over 42,000 people voluntarily resigning at a time when there are shortages. You've had huge experience in the sector. What does it look like on the ground? Is the crisis as challenging and as profound as the commentators are saying?
It is, and sadly, I agree. I think, as you've described very clearly, the facts speak for themselves. And I think what we're seeing now effectively is the perfect storm. As you've said, over 100,000 vacancies in the NHS. The pressures are unrelenting, I think it's fair to say, and like nothing I've seen in my career over the last 20 years, both in terms of pressures on the front door and urgent and emergency care. And of course, the very significant challenge we have across the NHS of addressing the elective backlog that has built through COVID, coupled with the fact that, quite honestly, our staff are tired. We're seeing more burnout. We know as a result of that, morale has taken a big hit. And staff sickness itself has had an impact. And of course, we know when we see increases in sickness, we have to rely, therefore, more on agency staff. And that comes with an added financial challenge and burden, in addition to the growing demand on our services. So adding all of those things together, it's a huge challenge. I think we have to understand the true impact of COVID coming to the fore. And quite honestly, people are choosing, we know, to leave the NHS. And I think COVID has made many of us think differently about our priorities in life and what we want in terms of work-life balance and more flexibility. But I think when you boil this all down, we need to stop applying short-term fixes to what is clearly a longer-term problem.
No, absolutely. And I want to delve into that a little bit because of the transformation that's taken place over the 3 years or so that since you've joined the Trust. But before that, I want to put it into context. The hospital that you serve has a very special, unique place in a rural community. We've also had, of course, legislation enacting the integrated care systems, so a very different platform. And the idea of collaboration, partnership, relationships has never been more important. Can you put that into context of just how important the hospital is in terms of its local economy as an anchor institution?
Oh, of course, hugely important. And we all know, whether it's in rural areas such as West Norfolk, where I work, or in cities across the country, actually hospitals effectively are at the heart of our local communities. And that's certainly the case in Kings Lynn. We've seen that through the fantastic response and support from our local communities during COVID. We've seen that in bucket loads when it comes to the new hospital campaign and the mobilisation of support. Quite literally, it's united our local community. And we talk a lot about anchor institutions. And I think we increasingly need to look beyond the walls of our own hospital and understand how we as healthcare providers can contribute more broadly to seeing our society flourish and truly understanding what that means in terms of working in partnership with other organisations, including increasingly local authorities and the voluntary sector, to truly make a positive impact on our communities. And there are so many ways we can do that. And
I want to now sort of expand upon that, because when you joined the Trust, it's fair to say it was in a very challenging position. 3 years or so later, the CQC report demonstrates an open culture, speaking very positively on a number of things. Now, that's not been a journey that's been overnight. It requires huge transformation. We will talk about the corporate strategy, the clinical strategy in due course, the people plan that you've developed. But I wanted to start with, I think for me, what was very important is that you produced a framework of values to drive the decisions around fairness, etc. Can you elaborate upon how important those values are, what they are, and how they inform this transformation?
Of course, and you're absolutely right. If we turn the clock back 3 or 4 years ago, this hospital was quite literally the worst performing hospital in the country. It was considered a basket case. It was top of the agenda in terms of the national top of the office, in terms of being on the hit list, if you like. And that's not a good place to be when you look at, financial indicators. Staff survey was the worst in the country. Patient experience and safety concerns. Coupled with the fact that we were the most digitally immature hospital in the country. So we were bottom of the table on every indicator. The good news was the only way is up. So that presents real opportunities. But actually, at the heart of our challenge was working with an organisation and a workforce that was battered and bruised, and in some cases had actually given up.
Wow.
Where did we start? We had a very clear formula, and I think we've seen that being really central to our success of now exiting special measures over the last 12 months or so. And you're right, at the heart of that was being absolutely clear on our expectations and focus on our values. And quite simply, they are kindness, wellness, and fairness, and living our values and bringing our values to life in everything we do. And calling out poor behaviour, quite honestly.
No, and I think that takes courage. And I think why this is important, this journey to share, is that many trusts are at different places today in terms of the workforce. We are facing these challenges. And therefore, if we can learn from how a hospital, in your words, a basket case, to one that's actually got commendation from a CQC report, I think there's a lot of value in that. And talking around the open culture, around those values, one of the things that struck me was the importance that you gave to allow people to speak out. So the freedom to speak up, guardians, a blended model. Could you share a little bit about that? Because that helped with engagement in terms of people feeling truly part of one team.
It helped hugely, and this was central to creating a culture where staff felt safe. And we've certainly moved from an organisation when I started just over 3 years ago to one where the vast majority of speak up concerns went direct to the CQC because staff feared speaking up internally. There was real fear of detriment. And actually, staff simply bypassed line managers and went straight outside of the organisation. So we've changed that. We've turned that around. Really pleased to say we've chosen as a board, actually, to invest significantly in this agenda, from 30 hours per month of support to 120 hours of support. We have a blended model. We have a full-time freedom to speak up guardian. We have then a supporting staff guardian and then some independent resource. So we have a blended model that works incredibly well so that staff have options, both staff guardians and that independent resource. But really importantly as well, underlaying all of that, we have a superb community of some 20 plus freedom to speak up champions spanning staff groups across the organisation, a volunteer, and a governor, and this model is really serving us well. And I'm pleased to say this year I know we will exceed 200 cases of speak up internally. We've had no cases go straight to the Care Quality Commission, so a total U-turn from 3 or 4 years ago. Cases are closed very quickly, so that staff have confidence. If they speak up, they know the cases will be taken seriously, they will be dealt with and closed. And we know from the feedback we get from staff that we have no evidence of staff considering they experience detriment as a result of speaking up. So there are some really positive signs there. And we had that endorsed via our CQC inspection if we turn back the clock 12 months ago.
No, that's a remarkable turnaround. And as you say, if we create a safe environment for people to share their concerns and challenges, that will allow, over time, of course, engaged staff and clinical outcomes. There's a relationship which is well established in the literature. I wanted to move on to the people plan that you've created with the goal of creating a workforce fit for the future. And number one, action one, is obviously the health and wellbeing. Again, a subject I know which is very close to your heart. You talked about the fact that the staff were tired, demoralised, plenty of literature to show that. And we could be here for a long time, but I just want to pick out a few things that you think were particularly interesting to get people's well-being and support throughout their journey. I know you've advocated menopause, awareness, together with, of course, what seemingly seemed like a simple thing, but extending free car parking, which makes a huge difference in terms of people, the cost of living crisis.
Of course, and a few things here. Firstly, wellness is one of our 3 values. And actually, we flipped this on its head. So this is not about supporting staff when they get sick and getting staff into work. It's actually about keeping staff well and keeping staff in work to prevent them from getting sick in the first place. So I think that's a different way of thinking about wellness. And we often talk about sickness. We talk about wellness rather than sickness, because I think that's hugely important. And we know if staff are to be at their best for patients, we have to absolutely make sure we invest in our staff. And we've done that by investing very significantly in our health and wellbeing programme, which is part of a much bigger staff engagement programme. And some examples of the areas we've invested in include, we have a class-leading clinical psychology team who work both individually with our staff where they have concerns and need support, but with teams, and that was hugely important during COVID, including on our COVID wards. We have a fantastic community internally of mental health first aiders who support our staff. We have a nationally recognised menopause programme. So we achieved menopause-friendly accreditation with the first NHS trust in the country to do that. We have a fantastic package of support around menopause. All of our policies are updated to reflect that. And a really big focus on mindfulness and staff, encouraging staff to take time out, to have their breaks, to have health MOTs. And recently we agreed with our all of our workforce to give every member of staff a wellness day this year. So an extra day off. That's how important we take that across the organisation. And you're absolutely right. We took the decision in response to staff feedback last year to invest in 3 or 4 what I call big ticket areas that we know are really important to staff and in turn their well-being and wellness. And that includes free car parking. It includes half-price gym membership, which has been hugely successful and well received by our workforce. Discounted meals, recognising the cost of living crisis and the challenges, the additional challenges that presents for staff, and introducing hot food at night and that package of staff incentives and benefits. Not only demonstrate that we're absolutely putting wellness of staff front and centre of our agenda as a board, but it also demonstrates, really importantly to me, that we're listening to staff feedback and acting on staff feedback.
And that, I guess, is incredibly pertinent right now. Again, the same NHS data that showed record numbers leaving, it also highlighted of those 42,000, worryingly 7,200 left for work-life balance reasons, the highest number ever. So I think this framework that you've developed is something that all of us can learn from. I wanted to move to the NHS People Plan, compassion, inclusion, and your People Plan, of course, talks around Action 3, ensuring that there's a sense of belonging for all. I know this is a subject very dear to your own heart and to the whole of the Trust. So can we expand a little bit about how important that was in terms of your fairness value, of course, and what you actually did? I think there's a number of networks that you supported and empowered to come forward and promote these values.
You're absolutely right. This is something that is very close to my heart. In fact, I've just in the last hour had the absolute privilege of formally opening our new multi-faith rooms. That the heart of that is creating an inclusive culture in the organisation. But I think there are some really practical things that we've done to not just say we are committed to creating an inclusive culture, but demonstrate we're actually doing that in reality. And if I could give some examples, culture starts at the board. I'm really clear about that. We have a reverse mentoring programme that started at the board, that has now cascaded down the organisation. As you say, we have a number of staff networks who have been key to driving this agenda forward, including what we call our REACH network, so Race, Ethnicity and Culture Heritage Network, LGBT Network, which I have the privilege of being the exec lead on, Disability Network, and finally our Armed Forces Network. They are driving forward really positive changes for patients and staff and changing the culture of the organisation for the better. We celebrate the cultures that make up Team QEH in some really obvious and visible ways throughout the year. For instance, we celebrate the different nationalities we have in our hospital on lift wraps in the hospital. We celebrate Black History Month, we celebrate Pride, Diwali. All of those occasions are hugely important, and we have an equality, diversity and inclusion calendar that we use actually. So we have absolute focus on those key events and milestones each month of the year. One of the other things that has been really critical and seen improvements was there was a perception of a lack of fairness on interview panels and recruitment processes, and therefore a suggestion that there can be unconscious bias at times. So we took the decision to make sure there was representation on interview panels, of having a BAME member on panels, but also making sure our interview panels are gender balanced and that is monitored. And quite simply, interview panels and recruitment processes don't go ahead if we can't demonstrate that fairness element, and that is serving us really well, and we're getting really positive feedback from our staff.
And I think it's important to bear in mind, it's wonderful to hear the extent of the initiatives. It's not simply a moral imperative, which of course nobody would disagree with, but also ensuring that we harness all the talent from people from all groups. It goes right to the heart of productivity.
It does. You're absolutely right. And also, for me, it's about celebrating difference. We call it Team QEH or Team NHS in some cases, and actually celebrating and embracing different actually gets better results. And as you say, that can be efficiency, productivity, but actually at the heart of that is having an inclusive organisation.
I wanted to move on to, of course, the broader picture. There are shortages. There have been vacancies now for a long time, over 100,000 pre-pandemic. International recruitment has its place, etc. But I wanted to focus on your commitment at the Trust to grow your own workforce. Your QEH People Plan focuses on harnessing talent, learning and development. Can you expand a bit on that? Because it's so important, not only in terms of meeting the vacancies pressure, but also in terms of the community and allowing the community to see the NHS as a place to work and wanting to work.
Absolutely. We are doing some fantastic work in this space that I'm really proud of, recognising we work in a rurally isolated area. We have to look at models such as Growing Our Own. We in the last year or so have opened in an innovative partnership with the Borough Council here and with the College of West Anglia, a new school of nursing. That gives us a pipeline for growing our own, quite literally, in terms of training nursing associates. We know we have cohorts then coming through the system on an annual basis, in addition to the international recruitment we do. We have, for a small rural district general hospital, I'm really proud that we have over 150 apprenticeships in place in the organisation, both in clinical and non-clinical areas, and that's serving us really well. And importantly, going back to the discussion we started earlier around being an anchor institution, it's really important that we support those with disabilities, those from disadvantaged backgrounds, to give just a few examples. To get into apprenticeships, to come and join us for work experience, and give those colleagues a real opportunity to have a career in the NHS, because everyone deserves that chance. So we're doing some great work there, coupled with a real focus on retention. Talk a lot about recruitment. We talk less about retention in the NHS, but we've got to start getting really serious, and we are doing that here. And as you touched on, a real focus, I think, in a different way for the first time in the NHS, on talent spotting and mapping, succession planning at every level of the organisation, not just senior levels from board to ward, and having really clear career progression pathways across every staff group in the organisation, and really taking that seriously.
I think the Trust has its corporate strategy at its centre is to be rated outstanding, I think, in 2025. And a lot of the work here obviously is the foundation for that. Now, you won't be here in 2025. I'd like to take the opportunity to congratulate you on your appointment as Chief Executive at NHS Orkney. You must be very excited about what that has to offer.
I'm hugely excited, both sad to be leaving the Queen Elizabeth Hospital, where I've had the most memorable 3+ years. And I think here with Team QEH have achieved some amazing things. I know the future is bright here, but equally I'm looking forward to my next challenge and my first Chief Executive post at NHS Orkney. Hopefully I can take some of the learning from the work I've done here and add to that in Orkney and move that organisation forward and make it a great place to work, but perhaps more importantly, deliver great patient care.
Absolutely, and I think NHS Orkney has its own vision to provide the best remote and rural care. Are there particular challenges? I know you're not in place yet, but are there particular challenges that you foresee that you want to tackle? Because the workforce, of course, it has its own unique geography and history.
Absolutely. It will come as no surprise to you at all that there are real recruitment challenges in Orkney. There are real culture challenges. Again, that's something I can relate to from my time in West Norfolk. And real opportunities around integration and closer working with local authority partners. And particular challenges in terms of closing the gap and reducing health inequalities. Well,
I'm going to wish you tremendous good fortune with that. I may take this last opportunity to recognise a quite distinctive aspect of your career, your professional leadership experiences in communications and award-winning, if I may say so. Some of us remember the programme Hospital, which you took into Nottingham. It's quite unusual to have someone with that background become a chief executive within the NHS. And I wanted to ask if you met someone who was a communications leader, is one, and has aspirations to become a chief exec, what perhaps 2 or 3 key things of advice you would give them to do that? Because you've mapped this path for them.
No, absolutely. And I think the first thing I say to the many people who ask me this question is, if I can do it, anyone can. I've had the privilege of working with some of the best leaders in the NHS over the last 15 to 20 years. And I've learned from others. I've learned as I've gone. I may have been in the right place at the right time as well and had a little bit of luck as I've gone, but I've worked hard. What I've learned is really great people skills, compassionate and visible leadership, and really great comms is at the heart of a really great chief executive. So I think in the future we will see more communications directors go on to be chief execs, is my forecast for the next decade or so. And fundamentally, it's also about not just the people side and culture side and getting that. It's about being a strategic thinker. And I think lots of communications professionals do that, but perhaps don't realise they do that because of the portfolio of communications. But if I can do it, anyone can. And as I say, I hope more people will follow in my path in the years to come. Well, on that inspirational note, we'll leave it. Thank you very much, Laura Skaife-Knight. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to find out more about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you and goodbye.